So today we're going to be doing some passive range of motion, or PROM, on an injured red-tailed hawk that came in with a deficit in its left shoulder. You'll notice that this bird does have its head covered. We do that to reduce the stress of the patients while we're working on them. So this bird has had an inability to get lift that it needs for release back out into the wild, and that's due to a restriction up in the shoulder girdle. So what we're doing today is going to be gently loosening up some of these muscles, stretching them slowly, and trying to get this shoulder back to its normal range of motion, just like you would do if you went to see a physical therapist after an injury. Much like when you're doing stretches yourself, if you have a tight muscle, you can sometimes be a little uncomfortable. So we always want to make sure that we hold that joint out just for a brief amount of time, give it a stretch, and then let it go and relax it. We will be doing this procedure for about 3 to 4 minutes on the shoulder. And then to make sure that the bird is using both of its shoulders normally, we will do that on the other shoulder as well.
And I understand that a lot of times we don't need to be this hands-on with physical therapy, because the way our enclosures are constructed, the ability to have free flight provides that physical therapy with many of the patients, correct?
That is correct. That's what we would call active range of motion, or AROM. And so this bird is also undergoing active range of motion in its enclosure as well. Some individuals do need a little bit more supportive care. This individual is also scheduled to be seen by our veterinarians over at CSU for further analysis and treatment to help with this wing extension. As we're doing this, it's really important to know the anatomy of your bird very intimately, to know what is appropriate as far as movement, and you have to be able to pay attention to the muscles and how they feel and the tension in the joint so that we can stretch them but not hyperextend them in any fashion. Okay, let's go ahead and move to the other shoulder.
Thank you, ladies.